Welcome back. It is 6:21 and May is Better Hearing and Speech Month. It's an opportunity to draw attention to how our hearing can affect other aspects of our health.
And it's an important thing to talk about as well. Hearing loss has been linked to a wide range of health problems, including dementia, other health issues connected to hearing loss, ringing in the ears, loss of balance, leading to increased risk of falls. Joining us now to discuss some of these findings is Dr. Amit Gosalia, and he's a doctor, of course, of audiology at West Valley Hearing Center. And Dr. Gosalia, thank you for joining us. Really appreciate it. So exactly what was found in this survey? Talk about that first. Good morning to you.
Good morning. Thank you for having me on again. So first of all, I want to specify that May is actually Better Hearing Month, and we actually went down to City Council back in 2018 and did a proclamation. And the importance of hearing is that approximately 5% of the world's population, which is about 430 million people, have some form of hearing loss. By 2050, we're estimating that number is going to jump to about 700 million. That's about 1 in 10 people around the world. However, in the United States, currently, it's actually about 15% of adults have some form of hearing loss, and most wait about 7 years to do something about their hearing. Now, why is this so important? Why are we even talking about this today? Because back in 2020, of course, we were in the middle of our pandemic. The Lancet Commission came out with a stunning report that actually stated that hearing loss in adults was the #1 risk factor for dementia. This is a huge study that came out because obviously dementia is a very huge chronic condition. Hearing loss being one of the largest, or the third largest chronic health condition in the country. Dementia, of course, being a huge one as well. The correlation of the connection between both is humongous. So Johns Hopkins actually started to do a study because we know that hearing loss being the #1 risk factor for dementia, how can we put off some of these symptoms? And so they started a study back in 2021 with the National Institute of Aging to find out if hearing aids can put off some of these dementia cases and to see if that can help.
Any word on the research from that? I think that's the biggest thing, right? You know, when you talk about how these are both two huge issues affecting so many people, any word on prevention?
That's a great question, Brooke. And so what we look at is when we talk about cognitive decline, when we look at hearing loss, right? So hearing loss, what happens, we're putting strain on our brain to try to hear better. And so a lot of these patients who have these symptoms of dementia, we're not able to fill some of those voids. So our brain's trying to work harder and harder and harder just to hear because we're missing some of the words that people are saying. So the studies are going to, the research is going to conclude in 2023. So unfortunately, we have to wait. However, I can tell you that at least in our clinic in West Valley Hearing Center, we do some screenings, which are cognitive screenings. And I know nationwide, there are other doctors as well who have been doing these studies, and we're seeing some pretty positive results that if we can take care of your hearing, we might be able to help. Now, I want to make something very clear. This does not mean that go get hearing aids because you won't get dementia then. That's not true.
Right.
So I want to make sure we understand there's correlation, not causation, which means that, we can help, but it doesn't mean that you have to go out and get hearing aids to prevent dementia. That's not accurate.
Do you think that people just neglect it when they have hearing loss of some kind? They just decide that, I don't know, maybe it comes with age, or they just think that is just something that is inevitable and there's not really much they can do about it?
Yeah, Tony, that's a great question as well, because what we have found is that it takes an average of 7 years before someone does something about their hearing issues. And the reason why is because, in our profession, we call hearing loss the invisible disease because there's no pain associated with most hearing loss and nobody can see it. It's usually the family and friends around you who notice it first. And so there's a stigma, right? There's a stigma attached to hearing loss that people think hearing loss is mainly for retired Americans or somebody who's over the age of 80. Well, that's absolutely not true. We have data to show that only half of those with hearing loss are over the age of 75. Of course, the other half being under the age of 75 and 18 plus. So that stigma is a huge thing. And, when we test our patients, and again, we test patients from birth to the other end of the spectrum, and we're seeing significant numbers of patients with hearing loss.
Dr. Gosalia, thank you so much for being here with us. May is Better Hearing Month, so it's important to stay on top of that and not let the stigma attached cause you, to have adverse effects on your health.
Good information, important issues. Dr. Gosalia, thanks so much. Appreciate it. 626.
Yeah, still ahead, a celebrity chef goes on trial for sexual misconduct charges.